Introduction. The symptom you didn't expect. When you think about hormonal changes after 40, you probably think about hot flashes, mood swings, or sleep issues. But your mouth? That's usually the last place anyone looks. Yet many women begin noticing subtle but confusing changes like gums that bleed more easily, increased tooth sensitivity, dry mouth that wasn't there before, or even changes in taste. If this sounds familiar, here's what you need to understand. Your oral health is directly connected to your hormones, and during midlife, those hormonal shifts can quietly affect your teeth, gums, and overall mouth health in ways that are easy to overlook. The important part is this. Once you understand what's happening, you can take simple, effective steps to protect your oral health. In this video, we'll break it all down in a clear and practical way. You'll learn how hormones affect your mouth, why these changes happen after 40, the 8 key signs to watch for, and what you can do to support your oral health long-term. Why hormones affect your oral health. Your mouth is not separate from the rest of your body. It responds to internal changes just like your skin, bones, or muscles. Hormones like estrogen and progesterone play a direct role in oral health. They help regulate blood flow to the gums, control inflammation, support saliva production, and maintain a healthy balance of bacteria in the mouth. As these hormones fluctuate and decline during perimenopause and menopause, several changes can occur. Gums may become more sensitive and reactive. The mouth may become drier due to reduced saliva. The balance of bacteria can shift, making irritation or infection more likely. This is why oral changes can happen even if your dental hygiene routine has stayed exactly the same. 8 signs. Hormonal changes may be affecting your oral health. Let's go through the most common signs so you can recognize them early and respond with confidence. 1. Bleeding gums. If your gums bleed when brushing or flossing, it is often one of the earliest signs of hormonal changes affecting your oral tissues. Hormonal shifts can increase blood flow and sensitivity in the gums, making them more reactive to plaque or even gentle brushing. This does not always mean poor hygiene. It may mean your gums are simply more sensitive than before. 2. Swollen or tender gums. You may notice puffiness, redness, or tenderness in your gums, especially while eating or brushing. This is usually linked to increased inflammation, which becomes more common when hormone levels begin to fluctuate. Your gums may feel different even if nothing has changed in your routine. 3. Persistent bad breath. Bad breath that lingers despite good oral care can be frustrating and concerning. This can happen because hormonal changes may alter the balance of bacteria in the mouth or reduce saliva, which normally helps cleanse and protect your oral environment. When bacteria builds up more easily, odor can follow. 4. Dry mouth. Dry mouth is one of the most common but often overlooked symptoms. Saliva plays a critical protective role. It helps wash away bacteria, neutralize acids, and protect teeth and gums. When saliva production decreases, your mouth may feel dry, sticky, or uncomfortable, and your risk of cavities increases. 5. Increased tooth sensitivity. If you suddenly feel discomfort when eating hot, cold, sweet, or acidic foods, your teeth may be becoming more sensitive. This can happen due to gum recession, enamel wear, or changes in the oral environment linked to hormonal shifts. Sensitivity is often one of the first signs that protective barriers are weakening. 6. Receding gums. You may notice your teeth looking slightly longer or your gum line pulling back. This is called gum recession. When gums recede, the more sensitive parts of the teeth become exposed, which increases discomfort and risk of decay over time. Hormonal changes can contribute to weaker gum support structures. 7. Changes in taste. Some women notice a metallic taste in the mouth or a reduced ability to fully taste food. This may feel subtle at first, but it can affect appetite and enjoyment of meals. Hormonal fluctuations can influence how your taste receptors function. 8. Higher risk of gum disease. If early symptoms are ignored, they can progress into more serious conditions like gingivitis or periodontitis. This is where inflammation becomes more persistent and can begin to affect the deeper structures that support your teeth. Early awareness is key to preventing long-term complications. Why this matters more. After 40. After 40, especially during perimenopause and menopause, your body goes through several changes that affect how it heals and responds to inflammation. Estrogen declines, tissue repair slows down, and the body may become more sensitive to irritation. This means small oral health changes can become more noticeable if they are not addressed early. And it is important to remember this. Oral health is closely connected to overall health, including heart health, immune function, and inflammation levels in the body. Taking care of your mouth is part of taking care of your entire body. What you can do to protect your oral health. The goal is not perfection. The goal is consistent, supportive habits. Start with your daily oral care routine. Brush twice a day and floss regularly, but focus on gentle technique. Overbrushing can sometimes increase sensitivity. Stay well hydrated throughout the day. Water supports saliva production, which is essential for protecting your teeth and gums. Pay attention to nutrition. Calcium supports strong teeth, vitamin D helps absorption, and antioxidant-rich foods help reduce inflammation in the gums. Keep up with regular dental visits. Professional checkups help detect early changes before they become more serious issues. Support your overall health as well. Stress management, quality sleep, and balanced nutrition all play a role in reducing inflammation and supporting hormone balance. Most importantly, pay attention to changes. If something feels different, don't ignore it. Early awareness makes a major difference. Your mouth is not isolated from the rest of your body. It reflects what is happening internally. Hormonal changes after 40 can affect oral health in subtle but meaningful ways. The key is not to feel alarmed, but to stay informed and proactive. When you understand the signs, you can take simple steps to protect your teeth, gums, and overall health. This is not about fear. It is about awareness and prevention. At Leap 2. Better Health, we help women over 40 understand their bodies and make informed, practical decisions for long-term wellness. If this video helped you understand your oral health better, let's continue the conversation. Comment below. Have you noticed any changes in your mouth or gums recently? Like this video if it helped you. Share it with someone who may be experiencing the same signs, and subscribe for more science-backed wellness education for women over 40. Because your health includes every part of your body, even the ones you don't always think about.